Hi, I'm Dr. Shefali Tyagi. I'm the obstetrician and gynecologist. Labor pains. Now, how the labor pains present is, basically if you've had those Braxton Hicks contraction earlier during the pregnancy, during later months of pregnancy, maybe 8th or 9th month, it's a painless contraction or a painless tightening of the uterus, which will last for a few seconds and come down. So if these Braxton Hicks contractions start getting accompanied with pain, that becomes the labor pain. So initially it can be little vague and not so severe, but slowly it will start increasing in the intensity and frequency. From once in 15 minutes, it can come in once in 10 minutes, twice in 10 minutes, 3 times in 10 minutes. So you can watch for this labor pain at home for 2-3 hours, and then you can decide to come to the hospital or call your doctor. The second symptom can be leaking. Leaking is when the water bag bursts. The water will be coming out, which will be the amniotic fluid. It can be a drastic event like the whole bed getting wet, or it can be a slow trickle that will just wet your clothes. You might be changing every 1 or 2 hours. Again, the wetness will be there. So anytime you feel that you are passing urine without your control, that is leaking. At no point you are going to pass urine without your control, so it's better to get checked rather than assume things. The third thing can be any bleeding or spotting. Sometimes the mucus plug which was in the cervix, which was protecting your cervix from infection all these months, will come out. It can be blood tinged. So that is called show. If it is minimal, you can probably wait and watch. If the amount of bleeding is slightly on the higher side, it is always better to be in touch with your doctor. The fourth symptom in which you have to be worried is decreased fetal movements. Fetal movements are very important because that shows the well-being of the baby. If the baby is happy, it will keep on moving. At any point the baby starts feeling unhappy inside the uterus, the baby will stop or decrease the movements. So anytime you feel that you have been feeling less movements for last 3-4 hours, it is very important to count the movements consciously. Eat something, lie down in left position, count for 2 hours. You should find 10 movements in those 2 hours. If you can't find those 10 movements, please be in touch with your doctor. So these are the 4 symptoms in which you need to go to the hospital: labor pains, leaking, bleeding, and decreased fetal movements.